cotton, with the, like this pressure on the tissue, real pressure, pressure here, this real pressure. When it's passive, there will be bleeding, and post-operative bleeding it will be severe, and the patient will blame you. So you make sure there is a gauze, thick gauze, not on the lingual side because it's gag reflex. Get it on the buccal side, but it's full on the socket. All the socket will be involved, okay? Like this thick, around this same thickness of the tooth, and there's real pressure. If there is no tooth on the opposite, make it bigger, so it press with the residual ridge, the real pressure, for 1 hour, okay? Not half hour, 1 hour. Let's make difference. When there is pressure on the tissue for 1 hour, the blood vessels really will be clogged, will be blocked. It's big difference. Spit. Most of the patients, they're gonna spit. Tell them don't spit, but it doesn't work. Most patients will spit and there will be bloody clot. But the significant is there's pressure, especially upper wisdom tooth. Upper wisdom tooth, you think it's not vascular. The tuberosity is very vascular. Come on. Medication. Zainab, we extract the wisdom tooth. She didn't take the medication. And she's a doctor. She forgot to take the medicine. Yeah, you can have, go ahead. I'm almost finished. She said she didn't have any pain. She could, I gave her the anti-inflammation, reduced inflammation. You should give it before and after. Okay. So reduce the inflammation, swelling. So I had trismus. She got trismus because of that. Because she doesn't have pain, but I want inflammation. Sometimes we give them steroid. Okay? So post-operative instruction, you have to insist on the patient to follow them. Don't spit. No smoking. Smoking is very dangerous because it's heating will increase the most of our patients, they are smoking. I tell them to swear on Quran. They have to swear there's no smoking because the smoking will get bleeding and they will blame you. Okay. Antibiotic. Antibiotic is not recommended, but in the circumstances we live here, and the patient troublemakers, we give them antibiotic as a prophylactic. Mouthwash, make it second, third day mouthwash. Why? Odema, swelling, odema. Mouthwash will be third days. But because the patient get confused, they might get mouthwash in the same day, so we skip that. Unless the patient is educated. Even when patient educated, his patient is a pharmacist. He's a pharmacist and he did take medicine. He takes medicine and get infection. So, and Zainab, she's a dentist. And they didn't follow the instructions. So, I don't know, but you have to insist on the patient. You have to read these things for them. You don't give them there. You have to read these things for them. Thank you.